So welcome everyone to the Minnesota Public Health Association's Stable and Safe, Addressing the Health Needs of Urban Unhoused People. And this is part one of a two-part series. As I mentioned, this presentation will be recorded. Please keep yourself muted. You may keep your video on or off. And I'd like to acknowledge that the funding for this event is generously provided by the Blue Cross Blue Shield of Minnesota. This is part of MPHA's Racial Equity and Advocacy Initiative, work that we've been doing over this past year with a multitude of partners. And this is MPHA's Ancestral Land Statement. The link for this is on our website at the bottom. And I'd like to read it and note that anyone is welcome to use this statement. This was created by our Health Equity Committee. And it's, as I said, the link is at the bottom for it. We ask that you take a moment to honor and acknowledge that we are on the ancestral homelands of the Dakota and Anishinaabe. Indigenous people have a long-standing history and connection to the land since time immemorial and are the original stewards of lands and waters. Many American Indians were forcibly exiled from their lands because of aggressive and persistent settler colonialism and US governmental policies, but they persevered. We make this acknowledgement to honor the Dakota and Anishinaabe people, ancestors and descendants, as well as the land itself. And I'd like to introduce Morgan Mulhern, who's the project manager for this Racial Equity and Advocacy project. And Morgan will introduce today's presenters.
Hello, my name is Morgan Mulhern. My pronouns are she, her, hers. And I actually worked for Hennepin County as part of the emergency response team at the decentralized sites the first year and a half of the pandemic, which is where I met Mikkel Beckman. And he was an incredibly thoughtful, compassionate leader in this space with a strong drive to end homelessness. Mikkel Beckman leads Hennepin County's planning efforts to make homelessness rare through prevention and eviction reduction strategies. For over 31 years, Mikkel has worked in the public health and nonprofit worlds, managing programs and organizations working to end homelessness, create supportive housing, and enhance housing stability. He is currently a senior department administrator in the housing stability area for Hennepin County, Minnesota. Markus Klimenko is a human services area manager for housing stability and leads the Making Homelessness Non-Recurring efforts at Hennepin County. The non-recurring efforts involve supporting a large portfolio of affordable and supportive housing and ensuring that the quantity, quality, and variety of affordable and supportive housing programs continues to grow to meet the various needs of Hennepin County's most vulnerable residents. Markus is a licensed psychologist and his background is in health and human services, housing, homelessness, and mental health. It is my absolute pleasure to welcome Markus, Klimenko, and Mikkel Beckman, and for all of us to be here to really highlight homelessness as an urgent public health concern requiring immediate attention.
Thank you. And welcome everybody. I'm grateful for everybody who's attending. Obviously, Markus and I are both have a lot of passion and a body of time, I guess, devoted to ending homelessness and providing housing stability for the most vulnerable people in our community. And together we've been doing this kind of presentation, which is really a look backwards. And we normally give this 90 minutes to 2 hours, and we have about 45 minutes today. So we apologize if we just jump right in and start moving forward, but you are going to get a somewhat abbreviated lecture on a look back on the history of homelessness. Real quickly, why is it important? Eduardo Galeano talks about the fact that to remember the past is to imagine a different future and to use history and memory as a catapult to change the future. And the decisions we make today create tomorrow. And we all woke up today in an unequal and divided community where there were people living outside and in homeless shelters. And we wonder, how did we get here? Why do we live in a community like that? How do we move forward? So those are some of the things we're going to kind of be looking back at. And I guess I would just end our intro by saying, Sergio Loscano, the Mexican intellectual, says there's no faraway place anymore in this very small world that's connected and maybe overconnected. But he says there's only two geographies, the geography of above and the geography of below. And I think on your journey from life to death, really the only choice is to decide which of those worlds you want to be in solidarity with, and what form does that take. So public health is an awesome forum for you to take to be in solidarity with the geography of below.
Thanks, Mikkel. I'll just add to that this presentation is pretty straightforward. We do introduce a lot of information, but the primary message is quite simple, and it kind of builds on what Mikkel was just stating. Historical U.S. policy decisions around the use of housing and land, space, and actually space in general has created racial inequities and gross disparities that continue to exist today in the affordability and availability of housing. And this has just resulted in the rise of homelessness and severe housing insecurity. And you will see that theme throughout this afternoon's talk. Go ahead and you can start the PowerPoint and we can get started here. And go ahead and move to the first slide. I can read this one, Mikkel, and then you can make some comments. Evidence, this is a grounding statement as well. Evidence points to the role housing plays as an essential platform for human and community development. Stable housing is the foundation upon which people build their lives. Absent a safe, decent, affordable place to live, it is next to impossible to achieve good health, positive educational outcomes, or reach one's economic potential. By the same token, stable housing provides an ideal launching pad for the delivery of healthcare and other social services focused on improving life outcomes for individuals and families. More recently, researchers have focused on housing stability as an important ingredient for the success of children and youth in school. When children have a stable home, they are more likely to succeed socially, emotionally, and academically. Mikkel, do you want to add anything?
Just that housing, we talk a lot in our work in our area at the county about housing as the essential platform. It really is essential. I think back to my days working in shelters and in programs for people who are homeless. And, without housing, you really can't accomplish much. Your life gets reduced to the day-to-day survival and day-to-day decision-making. Is this a safe place for me? Where can I find supper? Where can I find a bathroom? If I sit here long enough, will the police show up and give me a ticket that I can't pay? And will I end up in the workhouse for 30 days? And so, the impossibility of dreaming and scheming and planning for a life and for tomorrow evaporates when you don't have housing. And so it is the essential platform. And so no matter what your endeavor or what system you may end up working in, if you don't have strategies and a knowledge base around housing stability, your outcomes are not going to be as good as they would if you did.
The only thing I want to add to that is that I think is in our journey, I think speak on behalf of both Mikkel and I, this is probably the third or fourth time that we've done this. And each time I learn, and I think we learn, is housing is foundational to racial equity, and it ties to every other system. So what we want to do, and this is really the primary slide that we're going to focus on today, is this historical context. It kind of did this, we walk through a variety of different historical as well as current, and we tie these together again as Mikkel started the talk this afternoon. Mikkel, do you want to go ahead and frame this, and then we can get started?
Sure. There's obviously people have experienced homelessness throughout our nation's history, but there have been 4 great periods of homelessness in our nation's history, with larger than normal numbers of people without housing. Post-Civil War era in the late 1860s, 70s, the Great Depression of the 1930s, when large numbers of people were on the move. And then if you're my age, I'm 58. So if you're my age or older, you might think back to your childhood or early years where the typical image of a homeless person was sort of a down and out single adult male living in a central downtown area in a cheap hotel or motel or flop house. That was from the third grade period, which was kind of the 40s, 50s, and into the early 60s. And what most people don't realize is many of those men were combat veterans from World War II and the Korean conflict, who were suffering from what we used to call soldier's heart. Now we have a clinical term for it, PTSD, post-traumatic stress disorder. And people who, didn't readjust and reintegrate, and often used alcohol as a coping mechanism to deal with the trauma they'd experienced. But this fourth period of homelessness really can be traced back to federal budgetary and policy decisions that started to happen in the early 80s, along with a few other things that we'll touch on related to federal mental health policy, income, and things like that. But so when I was, I'll just share a little personal history of just the coinciding of my adult life with the two generations of widespread homelessness in the U.S. When I was a freshman in high school at Minneapolis West High School in uptown Minneapolis in 1978, there were no homeless shelters in our community. And there were no articles written about the topic of homelessness. And in fact, homelessness was not a word that was part of our national vocabulary. If you do a LexisNexis article search on that word, hardly anything comes up at all. By 1982, when I graduated from West High, we had 15 homeless shelters in the community, and the topic was being written about somewhere in the U.S., if not daily, at least weekly. And you have to ask yourself, what happened between that time, between my 14th year and my 18th year on this planet? Did millions of Americans suddenly get lazy or get sick and decide to abandon their housing? The mythologies we have around why people experience homelessness that are so deeply ingrained in our national mythologies around bootstraps and freedom and independence and making your own way in the world really don't mesh with the reality of what happened. And what happened was, we pay taxes, most of us, unless you're a billionaire, but the rest of us pay taxes, and we send our money to Washington, and we elect people, and they're basically glorified pie slicers, right? They get the pie and they slice it up and send it back out the door into programs and that cover different things. And what happened with the pie slicers and in the early 80s was there was a dramatic shift, and there were huge cuts to domestic spending, especially going to urban America. So in the interest of saving time, I usually do a little quiz here, but I'll just tell you, again, when I was a freshman in high school, 26 cents of every federal dollar went to urban America, went to cities. And by 1982, 4 years later, 6 cents of every federal dollar was going to cities. That would be a massive disinvestment in a very short amount of time in anybody's imagination, right? And that money was not returned to taxpayers. It was all shifted, mostly to California-based defense contracting to fund the Cold War. And, it's ironic to me that, what it took in spending on defense to break the back of the Soviet Union and win the Cold War really was not at everybody's burden or expense. It was at the expense of urban, low-income populations. And I don't think this country has ever thanked those populations for their great sacrifice in winning the Cold War. I'm being a little ironic here. But really in the early 80s, with the Reagan administration coming in, but also with the Democratic Congress, there were massive shifts in spending. The federal HUD program, I think, was cut 90% or more. I mean, you can go back and look at the numbers, but pretty significant disinvestments in school, after school programming, job training, housing, healthcare, public health. And we've never really recovered from some of that. And it was no coincidence that you started to see people showing up on the streets. The very first homeless shelter in Minneapolis was opened by St. Stephen's Catholic Church in South Minneapolis, just off Franklin and Stevens. And they opened their doors as a shelter in December of 1981. and then several other churches followed suit after that. So that's enough about that. It's fairly well documented, but I think it is a little bit of, there's been a little collective amnesia on the origins of this fourth great period of homelessness.
Just was thinking is that, feel free, you guys, to put things into the chat. It's a way for you to communicate with each other. It doesn't have to be a question towards us. When Mikkel and I have done this, there's been a lot of chatter in, what people think and what people are feeling in response. And some of this is not new news to anybody. So the second bullet on here is the revitalization, gentrification of urban cities. And it overlaps a little bit with what Mikkel has been talking about. In the 50s and the 60s, the federal government subsidized the construction of the interstate highway system. Highways were frequently built through Black neighborhoods, many of which were physically destroyed in the process. Some local officials even used highways to separate Black and white neighborhoods, reinforcing residential segregation. And for many of you, I grew up in Hawaii, you learn these. I've lived here most of my life now, but what you learn very quickly, the Rondo neighborhood, Minneapolis North Side, that these were federal policies that also affected neighborhoods here in Minneapolis. Under the authority of the Housing Act of 1949, the federal government subsidized slum clearance and urban renewal programs. In the years that followed, many Black neighborhoods and other neighborhoods were declared blighted, seized by local governments, exercising eminent domain powers, and demolished. In the 60s, many local governments enacted zoning codes that disproportionately excluded Black families from suburban communities. I'll speak more to that a little bit later as well. And the last piece on this bullet is the demolition of SRO housing across the nation, and particularly here in Minneapolis. It was devastating to very low income renters. One such example is the construction of the Minneapolis Convention Center and the SRO units that were demolished. At least 350 extremely low rent apartments were demolished during the building of the Minneapolis Convention Center. And just as a historical note, Central Community Housing Trust, CCHT, was founded in '86 as a way to work towards the replacement of these units. CCHT today is known as Aon, and some of you guys are familiar with them working in the field. I'm going to move on to the next bullet here, the warranty of habitability. And I'm not going to spend a lot of time on this one, but I don't think it's something fairly new to me, this concept, and I think it is worth mentioning. With the introduction of municipal housing codes, the price of housing rose sharply. And I'm going to read a little bit from Jacob Vigdor, an urban economist. He describes this: housing looks fairly affordable in the 60s and in the 70s. Mikkel talked about the HUD and the federal government moving away from investing, but still in the 60s and 70s, there was still some affordable housing, but then really jumps between the 70s and the 80s. And if you look around, you say, well, what happened in the 70s that would have made apartments a lot more expensive? And the answer is the landlord-tenant law reforms. So up until about the mid-70s, and again, this is kind of hard to talk about. There's always changes that seem to benefit folks, but there's also some effects that happen because of that are rarely negative. When you rented an apartment prior, you rented it as is, which is to say the landlord didn't guarantee that the heat worked. The landlord didn't guarantee anything. The landlord's only obligation was to give you a key for the quiet enjoyment, and that was the legal standard. Well, the standard changed to this warranty of habitability, which is to say that apartments are no longer rented as is. Now, if you rented, you need to ensure that they were up to building code, that heat was functioning, electricity was working, running water, and all these things. So what ends up happening is that the costs that landlords have to put into housing are raised, and therefore rents are raised. What happened though, those are changes on the supply side, but we find that there was no commensurate changes on the demand side for these rising costs, either on the local, state, or the federal level.
Just as an aside, talking about single room occupancy housing, SRO housing as it's called. Thanks for asking that question, Nancy. Single room occupancy, it's typically a single room with a shared bath and kitchen down the hall kind of a thing. But actually, Minneapolis eliminated SROs from the zoning code completely, except in the downtown overlay area. But very recently, the mayor and the city council got together and changed that policy, and now SRO housing is again allowed in Minneapolis. This has allowed Hennepin County to purchase 4 hotels with the intent of owning them as publicly owned SROs that we will lease to nonprofits to provide extremely low income housing for folks. So it's been a great thing to see that kind of coming back. So are we ready to move on?
To the next bullet?
Yeah. So the other thing that happened, which is really clear, and you can see this in any chart you look up on productivity and wages. So throughout the 20th century, well, let me just step back. The American workforce is still and remains and has been the most productive workforce on the planet for a long time. Incredibly productive workforce we have here. And going back in time, all the way back to when they started measuring productivity and wages back in the early parts of the 20th century, so for like 100 years, wages and productivity rose together through time. And the more productive workers were, the more they were rewarded with wage increases. There was a decoupling of productivity and wages that happened starting in the mid-70s that it has accelerated over time. And in fact, now as productivity continues to rise, we see workers' wages, especially at the bottom, actually dipping in a downward direction. It leveled off and has dipped. Wages actually overall in the United States peaked in real dollar terms in 1973. A worker who made $4.22 in 1973 was making the equivalent of $33 an hour. When I was in high school, I worked for the Park Board, Minneapolis Park Board, running the sound system at the Lake Harriet Bandshell, and I was making $47 an hour. Not bad for a 17-year-old. And what we've seen is just a complete erosion of wages. The decoupling happened to coincide with the very first lobbying efforts by businesses. Business coalitions first formed in the 70s in a meaningful way to try to impact regulation of business and wages and things like that. We know that, for example, it's been recently in the news that in 1980, again, a fairly significant year in this topic, the starting wage of a truck driver in real dollar, fixed dollar terms was $120,000 a year. And we know that today the starting wage for someone in the trucking industry is roughly $30,000 to $35,000 a year. So across the board in a lot of areas, we have seen wages really stall out over time. And of course, we know that the cost of everything continues to rise. So the purchasing power of the people with the lowest incomes has really eroded to the point where it's become virtually impossible to stay housed. And we see a majority of renters in many communities paying more than they should for rent, sometimes 50%, 60, 70, sometimes 80% of their total income is going to keep a roof over their head. And so the people we see in shelters, for example, are the lowest income people in our community. And that's the one thing that everybody who experiences homelessness has in common typically is lack of an income to stay housed. It's not about people's personal issues. People have them. We all have them. Everyone on this call has them. I have them. But I have an income. I have insurance. I have connections to family and friends and neighbors and a support system. If I need it, I know how to find resources if I need it. So the people we see showing up in, for example, homeless response systems and shelters typically are incredibly low income and don't have those connections and resources and don't have the coverage that allows them to address some of their issues and needs. So it's not, again, just important for you to know it's not about personal issues, but we really have seen an economic shift in this country in a dramatic way that coincides with the occurrence of homelessness at high rates in our country over the last 45 years.
And do a quick time check, just kind of seeing where we're at right now. It's almost close to 1:30. So we're gonna move through this kind of rapidly, as we said. So before I talk about the last bullet, this is worth mentioning. The historical shift that happened, the emptying of the hospitals and what was supposed to be the more humane community care in the form of community mental health centers is significant in this story as well. In the 60s and the 70s, many state-run mental hospitals were closed, which meant that discharged patients were supposed to be treated in our communities. As you guys know, that didn't happen. I went to school in Chicago, got my training in Chicago, and many of the folks who were let out of the mental institutions in the 50s and 60s were still there in the 70s and the early 80s living on the street. Thorazine came out in the early 50s, in the late 50s and early 60s, and that was supposed to be the wonder drug that was supposed to allow people to live normal lives. Money from the institutions never followed them out in the community. And I worked in a mental health center, and you could very much see that there was not money there to serve the populations in the inner cities. So now to the final bullet, and this is it's a crucial one here. And I want to start with, there is a little bit of a silver lining in the story. And I'm finding that there's much written on some of the things that we're talking about. And even the colleges and universities these days are regularly teaching some of this history, but it's not happening enough. So let's walk through a condensed and partial timeline. And this is kind of overlaps a little bit with some of the comments I made in the revitalization and gentrification. So in 1862, the Homestead Act displaced Native Americans and gave more than 270 million acres to private citizens. Today, 46 million US adults can trace their wealth back to this policy. In 1935, the Social Security Act brought retirement and unemployment supports for workers. But because it excluded agricultural and domestic workers, 65% of Black American workforce did not benefit. They didn't receive the economically stabilizing government help that kept recipients out of poverty. For more than half of the 20th century, policymakers at the federal, state, and local levels pursued development strategies that had a devastating effect on families of color, and most particularly African American families. These policies included redlining, restrictive covenants, the interstate highway system, as I mentioned, urban renewal, and exclusionary zoning. Federal housing policies barred Black families from the largest wealth-producing program in the nation's history, single-family homes created in suburban communities. In 2016, the median Black family wealth was $13,460, less than 10% of the counterpart 142,180 white family wealth. Slightly more than 25% of Blacks had no or negative wealth relative to only a little more than 10% of whites. These wealth disparities are largely the product of post-World War II government policies that facilitated home ownership and wealth building for the white families that became America's middle class. More recently, and some of you guys may have heard some of this, there was some information, and there are two PhD candidates at the University of Minnesota, Rashad Williams and Rebecca Walker, have been studying how developers in Minneapolis, housing developers, colluded, and that's my word, colluded with the park board to drive up home values through private donations of land and then prioritizing park reformation and then adding covenants to the properties they were selling. This was primarily around land around Lake of the Isles and Cedar Lake. Now, this is something that I learned about in the last 6 months. I've worked in this field for almost 30 years, and there's new information coming up monthly about some of the inequities that exist in our system. The last thing I'm going to mention, and Mikkel, you could probably add to this too, is just the federal government having outsourced almost all of its housing production to the private sector. Yeah,
and just a couple things to add to that. When you think about, a long time ago, before widespread ownership of automobiles, workers had to live close to where the work was, where the factories were, where ports were, where railroad yards were, and that was typically in the inner city. As these planned communities were developed, the very first one, the most famous one probably is Levittown, that had an exclusive barring of African American families from moving into those communities. And so you saw white working people leave the inner city, move to these planned communities, and then over the decades watch these properties increase in value until, like some places like Palo Alto, they're worth $1.5 million. And that generational wealth gets passed on. And so then you had African American workers stuck in rental properties in very defined areas. And as the population grew, overcrowding, deteriorating conditions, and lack of opportunity as jobs also then left, created, what we used to call slums or ghettos, which became deserts of opportunity and then of course what happened was people, resorted to trying to figure out how to survive and make a living. These became areas of over-policing and sociologically sort of challenged areas, all because people were not allowed to follow the same opportunities that other workers were able to follow through federal public policy. And that's important to talk about implicit federal policy because this didn't just sort of happen. Every city in America is segregated. You can go to, I can get on an airplane, fly to any community, get in a cab and say, take me to the black part of town, right? This was by federal design. And if we know that, then we can ask the federal government about how to make reparations for those kinds of implicitly racist strategies that denied people wealth accumulation opportunities, homeownership opportunities, educational advancement for their children, et cetera, on and on. And so this becomes an important foundational conversation piece moving forward for those of you who are younger and will carry this fight forward into the next generation for reparations and those kind of conversations. So it's really important for you to understand that. Not to harp on it, but...
If there's anything, again, is that you walk away from today from this talk is that often the focus is on the people we serve as the problem. And what we are trying to hammer away here, look at the policies, look at the policies. The legacies of the policies result in the environment we now work in. Historical contexts leave us in a state of scarcity. This permeates all of our work. So the question I have is on a policy level, if we have had centuries of policies that have explicitly targeted people of color in negative ways, can we undo that harm with policies that don't explicitly target those exact same communities? Thought for you. So in the interest of time, Mikkel, we were going to cover affordability and availability. Do you want to cover those just briefly on a high level?
Yeah. So we can go on to the next slide. So one of the ways to make housing affordable is to intervene in the housing market. And in the United States, the beneficiary of most federal interventions are homeowners. So we have a mortgage interest deduction program that sends $170 billion out the door every year in taxpayer money that goes to homeowners. This is money right out of the national treasury. It's a form of housing welfare. It's hidden behind a fancy title. If you have a mortgage on a house that you own, you receive money back from the federal government through this program. The vast majority of that $170 billion goes to high-income people who make over $100,000 a year because the more your house is worth, the more you get back, so the higher your mortgage. So you can own up to 2 homes valued at $1 million and get a lot of money back. Low-income renters have a few resources, the most famous of which, or most well-known, is what used to be called the Section 8 program, which is a portable voucher that makes an apartment you rent affordable and you only pay a third of your income. But the money for that program is allocated by Congress. Congress has not made increases to that program that have kept up with population growth. So you see large waiting lists, sometimes are closed waiting lists for those programs. In Hennepin County, we have about 14,000 subsidies in the community for about 74,000 households that need them. So we have 74,000 households that make 30% or below area median income. On top of it, the cost of housing continues to go up, and we've kind of covered all of that, I guess, I think we can move on. But one of the things Matthew Desmond recommends in his book Evicted, which I would also recommend as a reading source, is he said, what if we capped the mortgage interest deduction program for higher net worth people and shifted about 40 billion of that over? We could give every household in America at 30% and below AMI income a universal housing voucher to make their housing more affordable.
One of the quick things I want to mention, Mikkel, is that when people hear about all this affordable housing being built, when you dig into it, you realize, wow, we're really not talking about the folks that Mikkel and I are talking about the deeply folks in poverty, homeless, families, and singles. Affordable housing actually starts for single-family homes at 80% of area median. And I want to just show this chart to you. That's $80,000 a year for a family of four can qualify for affordable housing. On the rental side, for a family of four, it starts at 50%. So that's a family making roughly $37,000 a year. And the folks that we are talking about and work with are primarily those at the deep end of the affordability, who are at GA are making $203 a month or SSI at $841. So just want to point this out. I think we can move on to the next slide, which is availability. And Mikkel, this is where you talk a little about for every 100 folks. Do you want to grab this one?
Yeah, again, we have a lot of people with extremely low incomes in our community. We did an income study of families in our shelter system, and we found, we weren't sheltering families that made $25,000, $30,000, $35,000 a year. We were sheltering families that made $5,000 to $8,000 to $12,000 a year in annual income. A lot of younger women with children who were working in the service sector, service industry for $10 an hour, but only getting part-time work and then having to supplement that part-time work with public assistance, which has been extremely low. Very low payments, especially in the TANF or MFIP program for decades. So here we have just some numbers, and I don't need to go through these in detail, but there's a fierce competition for housing that's extremely affordable. And maybe some of you have experienced this, trying to find a place to live that's a rent that's affordable. But when you have this fierce competition for an open unit, it's like any competition. Who's going to lose out? People with eviction histories, people with criminal histories, people with any barriers. And because people's histories are so visible now to landlords and the property screening companies that assist landlords in finding tenants, then anyone with a blemish on their record is screened out of those opportunities, and they end up in the worst conditioned housing. We know that evictions lead to families living in worse housing than they had before, in worse neighborhoods, where educational opportunities are limited for their children. And again, we know that 93% of all evictions happen just because people don't have money to pay the rent, not for other issues. And so again, it's an economic issue that gives you a scarlet letter that follows you as a renter for a long time.
And the statistic that we want you to walk away with is really for every 100 folks who are in that extremely low income category in the Twin Cities metro area, there's only 36 available slots. And in Minnesota General, 42. So that it is this musical chairs, musical housing that gets played. And it is really the scarcity model that the more folks we put in to help people find housing, if there's not enough housing, they're just competing with each other. So the next slide, if you want to move on, is really just a reflection question we want to leave you with, and then we have some resources at the end. I did copy some of those resources and put them into the chat. But Mikkel, do you want to maybe read Richard Rothstein's statement here, and then we can leave folks the question.
I recommend this book, Color of Law, highly to people. I recommend if you don't have time to read the book or can't afford to buy it, or if it's checked out of the library, there's some great lectures by Mr. Rothstein on YouTube, and you can go check those out. Just type in Richard Rothstein, Color of Law. But he says contemporary land use has been layered atop an infrastructure created by decades of racially discriminatory policies. Failure to remedy these injustices has created multiple crises. Homeownership is out of reach for many. Renters are overburdened. wages are inadequate for housing costs, affordable public housing is scarce, and housing infrastructure is neglected. These issues remain at the core of our nation's inequality. So there's the question is, if affordability and availability of housing is based in deep discriminatory historical contexts, what's our way forward?
And our intent was not to provide answers. Today was to lay the groundwork. And really, I think that's more important in some ways, because over and over, what you read about and hear about is the blame of those folks in poverty, those folks experiencing homelessness. You constantly hear about the drug use or inappropriate use of their funds and things like that. And we really want to provide this discriminatory policies discussion to that. And people can walk away with their own ideas about, wow, if federal, state, and local policies have been this strong, how do we really get ourselves out of this?
Yeah. And those are the conversations, at both at the policy level, but even individually. I met a woman once when I was working in a shelter, and she confided in me that she only took alleyways when she went walking, when she had to go places, because she was so ashamed of her status as a homeless person that she didn't want to walk down the streets with everybody else. And just a brief conversation with her, an explanation of sort of the environment and external things, I think helped give her a little bit more confidence. I mean, it certainly didn't change her condition at the moment. But the other thing to know is that homeless people aren't a separate class of people. Homelessness is an experience that happens to people because of these things we've talked about, because of these inequalities and injustices. And thankfully, for the vast majority of people, homelessness is a brief experience that doesn't get repeated. We looked at every single person who went through one of our largest single adult shelters in Hennepin County, going back over 20 years, and found that 80% of everyone who had ever stayed there stayed less than a week and never came back. And 50% stayed at least, I think it was a month or less, and never came back. And the people who got stuck on the streets were those with the most profound health issues related to mental health problems and substance use and extensive criminal histories and things like that. So thankfully for most people, I think it speaks to the creativity and ingenuity of people and their ability to share and survive, is that for most people, it is a brief experience. So I'm not sure if we have time for questions, but certainly willing to try to answer any, or if anyone has any comments or experiences they want to share or any remarks. Again, this is part one. We just wanted to give you a backward look in order to get you thinking about moving forward and how we might move forward differently.
I see that Gretchen Musicant has a raised hand.
Yeah, thank you. So as you're recounting these waves of history, and I think it is so helpful to be reminded about the massive social changes that happened in the 80s. But with the other waves, is there anything we can learn? Was there any intentionality about those waves going away or lessening, or was it just the accident of things happening, like, World War II or something like that?
You're on mute, Mikkel.
I'm sorry. I was saying I missed part of your question, cut out for me in the middle, and I missed.
Okay. I was just wondering, the historical lesson or pattern in how those other waves of homelessness abated or got better, or was it just a matter of accidents of other things happening, like a world war or like that?
Well, I mean, after the Civil War, we had masses of people. Again, a lot of veterans of that conflict went west with the westward expansion of the United States, and a lot of actually newly freed people left their areas and went west. And so, and with westward expansion and went out to California or became cowboys or were land, farm and labor and railroad builders as the U.S. expanded westward. In the Great Depression, things came around partly because of World War II and accelerated, ramping up of production of defense spending, and the end of the Depression. And a lot of the SRO dwellers, of course, tear down a lot of SRO housing, but the people didn't go away. They just got older and became shelter dwellers. My first shelter experience when I started working in a shelter in 1990 was actually a shelter for drinking men. So it was a 50-bed shelter, and you had to have alcohol in your system to get in. It was a way for chronic inebriates who were on the streets to have a safe place to be. And we provided shelter and 3 meals a day if people wanted to come back from meals. And I was astounded at the number of veterans. I shouldn't have been. I was young, but a lot of Vietnam era combat veterans and some of the Korean War older guys were still alive, were there. So does that answer the question?
Yeah,
Good
so
question.
fortunately, yes. So it doesn't seem like there's any lesson really to apply. It was just sort of luck and change of other things that helped. So we'll be intentional this time.
Yeah, thank you so much, Mikkel and Markus. This was so wonderful. Yeah, if everyone wants to give a virtual round of applause, but I think we will transition into our case study. And I think the question in the chat actually the next section is kind of about solutions that Rose is going to be presenting on. So I think that question that Molly has in the chat will really help drive this conversation forward.
Yeah, thanks, Morgan. And thank you, Markus and Mikkel. My name is Rose. I'm a first-year Master Public Health student, and I'm also a member of the Leadership Development Project through the Minnesota Public Health Association. I've learned so much, and I'm really excited to actually apply a lot of what we've learned about the history of homelessness into this case study. So you all registered, and you all should have gotten a case study called Homeless is My Address, Not My Name, which is an actual quote from a Minnesotan woman. And I think Morgan's also going to drop the case study in the chat. And so what we are hoping to do is essentially divide you up into a couple of groups, I think groups of 5. And we are going to ask you to read through this case study if you haven't already. And then also your task as a group is that you're going to imagine yourself to be a team of interprofessional individuals working to end homelessness in Hennepin County. And specifically because our case study, it focuses on quotes from women, your target population will be with women with children. And so your task is to propose a new and innovative service and solution to address housing insecurity for women with children. It could be completely new or building upon an existing infrastructure or systems in place. Might take a little bit of Googling, a little bit of creativity, but we want to leave it up to you all. And we definitely acknowledge we're about to give you about 15 minutes to do so. We acknowledge that if you can't come up with a solution in 15 minutes, but you can definitely work together and think of some solutions based on Mikkel and Markus's talk and just overall what is presented in the case study as well. So whenever you're ready, Morgan, to put individuals in groups, that would be great.
Okay, the rooms are open.